Okay, hi, Mike here again with Cody. Cody, do you want to tell the audience a little bit about why you're here today?
Well, because I'm here today because I was experiencing a lot of pain on my lower back. So just a short story. I had a bulging disc 5 years ago from deadlifting, and overall I lift a lot of weight. And after that injury, my lower back has been off and on. Sometimes it flares up, sometimes it's fine. It's been ongoing for the past 5 years, and recently I've been lifting weight again. And after a deadlift 2 weeks ago, and I noticed that there's a significant amount of pain running through my lower back and the upper portion of my butt. So that's why I came here to see Mike, and hopefully he can fix it up.
Yeah. So what did we do? We have seen you a couple of times now.
Yeah.
And then how are you feeling today versus you were two or 3 weeks ago?
Overall, I would say there's 60 to 70% improvement in both mobilities, and the pain level has decreased, and notice that there's more engagement in my lower back while I'm doing certain exercise and movement, and yeah, that would be something that I've been noticing.
Okay, you mentioned earlier though something about your leg buckling or giving out. Has there been any change in that?
For the buckling, I noticed that when I notice more when I'm standing for a minute or two, and then I try to walk to another direction, and then I'm noticing in the initial stage of the walking, I noticed there's some buckling going on.
Okay.
But other than that, I didn't notice that any other time.
Okay.
Yeah.
Okay, so we did a couple of sessions of lumbar extension because his diagnosis is that he's had a bulging disc.
That's correct.
It's the L5 disc?
L5 and S1.
Yeah, okay, so between L5 and S1.
Yeah.
So we'll do a lumbar extension based on the McKenzie technique and see if we can reduce that bulge, okay?
Okay.
So let's get your face down on the table.
All right.
Okay, and we're going to put a blanket across there. Just going to drop those arm pieces down. Take our trusty belt out and put that across. So we're putting the belt just at the border of the sacrum and the L spine, lower L spine. And tighten that up. Is that feeling okay?
Yeah.
Okay, a little bit of traction on those legs. And then I'll slowly start to raise the back side of the table to take them into extension. Again, I've had this table designed so that specifically you can do this by having these welded bars at the bottom here, which takes the belt away from those motors. Okay, how you doing, Cody?
A little bit.
A little bit of traction. Does the traction feel good or bad?
It feels good.
Okay. How's that height feel?
Feels good.
Okay. Now we can always take a measurement too to see how high up he is, and that way we can monitor the degree of extension. Get my trusty glasses on to see that. It's 46 centimeters right now. That height feels okay.
Mm-hmm.
Would you like to try a little higher?
Yep.
You tell me when to stop.
Okay.
He's doing pretty good.
Yeah.
How about there?
I feel a little bit compression on the right side of the gluteus area.
Okay, that's probably high enough to get the effect that we want.
Yeah.
And I can tell you how high you are. You're at 65 centimeters.
Wow.
65 centimeters, that's pretty good. And add a little traction. You can traction both legs at the same time or one at a time. Okay, so normally I'd leave this for a bit longer, but we're going to bring him down and see how he's doing. Down, down, down. Okay, and then we'll take the belt off. Okay, and you can just slowly get up and we'll see how you're doing.
I feel much looser on the right side. Well, when I have to say at the 75 centimeters round, I felt my right side of the lower back was spasming.
Okay.
But it was manageable. Then after you started to lower in the table, and now I feel that the range of motion has been much more increased.
Oh.
And feels warm and it feels fuzzy and stuff.
So you're happy with the results?
Oh, so far I can't complain.
Okay.
I like it.
Okay, good. Okay. Yes. Well, thanks. So I'm just trying to demonstrate lumbar extension to treat a disc herniation or a disc bulge. So that's one procedure you can use to treat that. Thanks for watching.